Adding a patient from their existing records is easy. Once you send your personal patient registration link to the patient, it will take them to a welcome screen on the Omron website where they input a few basic details which Hypertension Plus matches and verifies against their electronic patient record. If the details do not match, the patient will receive an error message. The submission of the initial patient details will start the registration process for you. To complete the registration, you will find the record under Incomplete Registrations on the Patient Registration tab, here on the right-hand side. Please note, you can only see patient information if you have the relevant HCP access in the system. Here, you will need to complete the mandatory fields as marked by the red asterisks. Continue through the registration by clicking the Next button in the bottom right of your screen. You can see where you are up to in the process with the navigation path on the left. Patient records can be saved at any point during the registration by clicking on the Save Draft button at the bottom of the navigation path. NICE recommendations for treatment of hypertension vary depending on a number of factors, including blood pressure level. If a patient is not currently under hypertensive treatment, the latest blood pressure will be used to determine the treatment recommendation. Hypertension Plus checks for any recorded medical intolerances within the patient's medical record and considers these when creating treatment plan recommendations. Intolerances can be identified at class level or at an active drug level. When the checkbox is marked, Hypertension Plus will exclude the class or active drug from the medication plan recommendation. When checking the registration, you can edit and update any data Hypertension Plus pulls from the medical records. This is done by simply clicking the relevant box. Relevant medical history information is pre-populated based on the patient's medical record, primarily using primary care ref sets of SNOMED codes. The detailed SNOMED codes can be found within the FAQ section of the help guides. Where a pre-existing condition is identified against the set of reference codes, Hypertension Plus will mark the condition as yes. The healthcare professional completing the registration will need to proactively complete fields which have not been pre-populated by marking yes or no, and if required, overwriting any pre-populated information. Hypertension Plus uses a 3-step medication plan as the basis for remote management and titration of patients. For most patients, the platform generates a recommended plan based on the NICE guidelines. This can vary depending on the medical history and current comorbidities of the patient. In certain cases, for example patients with evidence of heart failure, Hypertension Plus cannot automatically recommend a treatment plan due to the complex management pathways for the patient. Hypertension Plus can still be used to manage these patients remotely, however treatment plans must be inputted manually by the clinician. All fields in a plan can be edited and these changes will be recorded in the patient's record. After completing the plan, click Next. The final medication plan for the patient is displayed. Review the plan and if satisfied, click Approve, at which point the plan will be saved. If the plan deviates from the base recommended plan, the approver will need to complete a comment box to state the reason for this. The patient registration will be complete and saved once you approve the full treatment plan. If the user is an HCP approver, an invitation is sent to the patient to download the Hypertension Plus patient app and view their medication plan. If the user is an HCP non-approver, the plan is sent to an HCP approver for confirmation before being sent to the patient. To go back to the overview screen, click on the Omron logo. Here you will find your newly created patient in your patient list.